Schizophrenia. What is it? You might have seen something like these stylized representations. They usually convey a high degree of sensory dysfunction, maybe with voices in the head. Schizophrenia is characterized by abnormal perceptions of reality. You might know that Vincent van Gogh suffered psychotic episodes, possibly from schizophrenia, and cut his own ear off. In reality, presentations of the serious illness are as varied as the people suffering from it. The Diagnostic and Statistical Manual of Mental Disorders, version 5, has 6 criteria for schizophrenia. First, one must have at least 2 of delusions, hallucinations, disorganized speech, disorganized or otherwise abnormal behavior, and negative symptoms like self-neglect and loss of drive. It's important to note that criterion A should always be considered in the context of an individual's culture. If a behavior is culturally accepted and causes no distress or impairment, it does not satisfy criterion A. Functioning must be significantly impaired, and at least some symptoms must be present for 6 months. The patient must not have had mood-related symptoms for a majority of the duration of criterion A symptoms, or have had depressive or manic episodes during their criterion A symptoms. The symptoms cannot be explained by the effects of a substance such as a hallucinogen, and if the patient has a communication disorder, such as autism, they must also have prominent delusions or hallucinations. Positive symptoms are generally defined as the appearance of thoughts or behaviors where there usually are none. Neologisms are the coining of new words or phrases. An example of a disorganized symptom is cognitive slippage, where objects are categorized overgenerally. Negative symptoms are the lack of a normal behavior, like alogia, which is a reduction in speech, or a flat affect, regardless of the situation. That was pretty uncomfortable, right? For some people, that's their reality. Now let's take a look at a portrayal of schizophrenia in the show Criminal Minds.
Don't you see that? Leave me alone. Look. The file, Ted. Look at the file. I told you what was happening. I told you where we were really going.
What the hell was that?
Everything's all right, folks. Everybody just relax. Everything's gonna be fine. Everything's fine.
What happened?
Nothing, ma'am. You on the job?
FBI.
Suicide. Somebody jumped in front of the train.
Is there
What the hell are they whispering about?
Unfortunately, we have this procedure down fairly well. Everybody just relax. Everything's gonna be fine. We're gonna be back underway again shortly.
Good.
Don't worry, folks. Like I said, everything's gonna be okay.
Never
Stay
smart.
easy, everything's gonna be fine.
That was heavy on the positive symptoms, with no sign of disorganized or negative symptoms. However, the man in the video would still meet criteria for schizophrenia if his delusions and hallucinations had been present for 6 months. This shows the heterogeneity possible from case to case. Etiology. Factors affecting the development. We will begin with biological determinants. Schizophrenia is heritable. The prevalence is about 1% in the general population, but much higher among relatives. Advanced parental age, above 35, is associated with schizophrenia. Studies have implicated several brain anomalies as well. One such example is the change from primarily the left hemisphere handling language functions to both hemispheres. The pathogenic protozoan Toxoplasma gondii can lead to severe brain lesions in the development of schizophrenia. Obstetric complications can also increase one's risk. A class of abnormalities deemed minor physical anomalies, such as the single transverse palmar crease and low set ears, are indicative of recessive mutations in one's genome and are also associated with schizophrenia. On to psychological factors. The odds ratio is a way of representing risk associated with a factor. Numbers above 1 indicate a positive relationship, with higher numbers corresponding to more risk. Social health, organizational ability, and intellectual functioning all predicted a significantly increased risk. Trauma in childhood, including all types of abuse, bullying, death of a parent, and neglect, also confer increased risk to an individual. There are many environmental factors. You can see birthdays in December to March were overrepresented in schizophrenia patients. This might be due to vitamin D deficiency in the last months of pregnancy. Growing up in urban environments is also associated with the development of schizophrenia. Traumatic brain injury can trigger psychosis. Schizophrenia is highly comorbid with substance use disorders, namely hallucinogens, cannabis, and amphetamines. Being a first or second generation immigrant also increases one's risk. The dopamine hypothesis has been proposed. It supposes that the aforementioned risk factors contribute to increased dopamine release in the synapses of the brain, which leads to the assignment of meaning, or salience, to otherwise meaningless stimuli. Cannabis use, or specifically the intake of its psychoactive ingredient, tetrahydrocannabinol, THC, is associated with significantly longer hospital stays in schizophrenia patients. Once symptoms appear, the clock is ticking, so to speak, as longer duration of untreated psychosis predicts higher severity of symptoms. Also, insidious or gradual onset is associated with lower overall functioning. This might be due to the slow development of symptoms being less alarming. More negative symptoms, like social withdrawal and apathy, and greater cognitive impairment also predict more severe cases. A phenomenon known as anosognosia, or lack of insight, is well documented. Many sufferers do not perceive their symptoms as resulting from an illness, so they are less likely to seek and adhere to treatment. Schizophrenia typically runs a chronic course with a poor prognosis. This graph is a representation of the negative symptoms over the course of a representative case of schizophrenia. One can see the predisposition and early life effects of genetics and trauma, leading to an increase in negative symptoms which are further exacerbated by resulting social isolation and possibly drug abuse. At some point, typically in the late teens to early 20s for men, or late 20s to early 30s for women, an individual will begin to suffer repeated psychotic crises. Studies have consistently found that schizophrenia does not often improve and few patients make a full recovery. This study, done on data from about 100 to 30 years ago, found a 40% average improvement rate. This more recent study showed that 48.9% of patients made some kind of improvement, 26.8% achieved adequate quality of life, and just 4% were classified as in recovery. The media and popular culture, such as Criminal Minds, often portray schizophrenia as a disorder that begets violence. In reality, a minority of schizophrenia patients ever display violence. Substance abuse, lack of treatment, anosognosia, poor impulse control, psychopathy, and the presence of positive symptoms, especially auditory hallucinations, are the strongest predictors of violence. Treating schizophrenia is very difficult, but is an area of much research. The treatment hierarchy by Argo et al. 2008 recommends trying first a second-generation or atypical antipsychotic, then trying either a different SGA or trying an older first-gen antipsychotic. Then trying clozapine, which is relatively more effective but comes with the risk of a dangerous drop in white blood cells. If that fails, clozapine is combined with other antipsychotics or electroconvulsive therapy. Extrapyramidal symptoms, abbreviated EPS here, are impairments of voluntary movement like slowed or jerky movement. Hyperprolactinemia is elevation of the hormone prolactin, which can cause lactation in women who are not pregnant and breast development in men. Weight gain and sedation are other side effects of antipsychotics that may contribute to distress in schizophrenia rather than relieving it. Treatment-resistant schizophrenia is well documented. Clozapine plus ECT is shown to be effective in reducing both positive and negative symptoms, but again, full recovery is rare. While the primary treatment for schizophrenia is pharmacological, non-pharmacological treatments can improve outcomes as well. Goals of these therapies are to promote compliance with medication regimen, improve social functioning, and help involve family members in an almost certainly long treatment process. Adherence to these often unpleasant medications is critical in treatment. More negative symptoms are associated with worse outcomes, possibly because antipsychotics do not alleviate negative symptoms as readily as positive and disorganized symptoms. Social support is also important. Higher BMI may be indicative of other poor lifestyle choices. There are many new treatments currently being investigated for this illness, such as music therapy. Anecdotally, it can improve symptoms, but more well-controlled studies are needed. New targets for pharmacotherapies are being discovered with the help of genetic sequencing, such as the neurotransmitters glutamate, serotonin, acetylcholine, and GABA, and their respective receptors. Inflammation of the brain has been implicated in schizophrenia, so anti-inflammatory drugs and immunomodulators are being investigated. CBD has shown a range of health benefits, and tests of its efficacy are still in the early stages. The degree of distress caused by schizophrenia and the current difficulties associated with treating it make research into new pharmacological mechanisms of action extremely important. Perhaps a new theory like the current dopamine hypothesis could help explain the wide array of risk factors and symptoms and better inform treatment. One recent interest in medicine is personalized treatment. In studies like Watmuth and Karmacharva 2017, researchers cultured neurons from a patient's stem cells. This, along with other pharmacogenomic approaches, allows for direct observation of individual differences and likely responses to treatments. For every improvement in treating this illness that strikes fear into many of us, fewer patients have to endure the horrors of untreated psychosis, and many more may return to normal life. Widespread knowledge of efficacious treatment may also encourage those with early symptoms to seek treatment sooner. Thank you.